Good morning, good afternoon, good evening, depending on your time zone. We'll be starting the webinar in just about 1 minute. Again, good afternoon, good morning, good evening, depending on your time zone. My name is Jay Hodes. I'm the president of Collington Consulting, and I will be your moderator today for this webinar. Couple housekeeping items. Everybody has been placed on mute, and there's no need to have camera activated. Talk a little bit more about Q&A in just a second, but we're going to go ahead and begin today's webinar. Does your organization understand HIPAA requirements? Really, the focus today is going to be on small to mid-sized providers and practices. Again, my name is Jay Hodes, the president of Collington Consulting. I've had my company for over 12 years now, providing HIPAA compliance services. We have a diverse portfolio of clients on the hybrid side, on the covered entity side, and the business associate side. I have served as the HIPAA compliance officer for the County of Fairfax, Virginia. I also was a former Assistant Inspector General for investigations at the U.S. Department of Health and Human Service. Quite a lot of experience in the field. I've served as an expert witness in litigation cases, and I've worked with organizations, regrettably, that have experienced breaches. I do some volunteer work for Lab Rescue with the Labrador Retriever Club of the Potomac, based in Northern Virginia, so that's around the Washington, D.C. area. Enough about me. Let's talk a little bit about today's webinar topics. We're going to look at HIPAA compliance regulations and requirements. There's a lot of acronyms in the HIPAA world, so we're going to cover a few of those. We're going to talk about what's needed in terms of meeting HIPAA policy and procedure requirements, a little bit about risk assessments, training requirements, and then really important, HIPAA compliance program management. We're going to talk about that. We'll kind of finish up with some recent OCR enforcement actions. That's the Office for Civil Rights. We'll talk about them in just a second. A little bit about our services, and then there'll be plenty of time for Q&A. When we get to Q&A, there's a couple different options. You should be able to see at the top of your screen a chat option or a Q&A option. Either way, you can put your questions into there, and I'd be glad to answer all the questions at the end of today's presentation. If you do hear me stop for a couple seconds every now and then, I'm probably just grabbing a sip of water. So let's go ahead and begin. So what does HIPAA stand for? It's the Health Insurance Portability and Accountability Act of 1996. Why is that underlined? Because we're dealing with requirements that really still date back to the 90s. And what HIPAA did is it set the federal statutory basis for establishing national standards for the privacy and the security of PHI, a first acronym. We'll define PHI in just a second. In 2009, again, somewhat dated legislation, the HITECH Act was enacted, the Health Information Technology for Economic and Clinical Health Act. And you kind of see some of the provisions here. What this did is it kind of cleaned up some of the original HIPAA privacy and security rule concerns, and it increased the number of penalties for repeated uncorrected violations and really developed a new breach notification rule. And then in 2021, the HITECH Amendment was introduced, where what this does is it covers what we call recognized security practices. It's not required, but if you do have a breach and you're investigated and you have these recognized security practices in place, you can use that in your defense during the investigation. Then really the last formal legislative update is what we call the HIPAA Omnibus Rule. And this really, again, went to clean up the original HIPAA regulations and HITECH. And what this rule did is it kind of required both business associates and their subcontractors to now follow the HIPAA requirements. It really strengthened some of the enforcement provisions for OCR. And again, we'll talk about OCR in just a second. But really, just making sure that business associates are held to the same standards for protecting PHI's covered entities. We're going to define business associates and covered entities in just a few minutes. So everything we talk about today is really based on the Code of Federal Regulations, the CFRs. There's what we call the citation, 45 CFR Parts 160 to 164, and they cover all the HIPAA security and privacy rule requirements. So again, just like we have the tax code in the US, well, there are these CFRs that pertain to HIPAA compliance. So when you're dealing with regulatory compliance, it's not like a consultant is just pulling this out of midair. Everything's really based on this code. So as I mentioned, who enforces HIPAA compliance? It's the U.S. Department of Health and Human Services. It's specifically the Office for Civil Rights, their acronym OCR, as we talked about. They enforce HIPAA compliance throughout the country. And HIPAA can also be enforced by the Attorney General of each state. If you notice in this slide, I have the seal for the state of New York Attorney General, because that office has been one of the more active AGs in the country enforcing HIPAA compliance regulations. And just to note, as of June 4th, a new OCR director was appointed. So again, these are political appointees that serve in these positions. There's only a couple of them actually with OCR, but the new director was named June 4th. So here's a classic definition of risk mitigation: steps taken to control or prevent a hazard from causing harm and to reduce risk to a tolerable, acceptable level. Well, HIPAA is an exercise in risk mitigation. The goal here is to prevent a breach from happening. So if you go back up to the first sentence, why is it underlined, reduce risk to a tolerable or acceptable level? Because you're never, ever going to eliminate total risk, right? It's get it to a point where it's manageable. A lot of things happen, right? We have human error. We have shortfalls on cybersecurity, preventive measures in which breaches do occur. But again, also we have to balance the business operation side into kind of our risk determination. So again, the goal here is to prevent a breach from happening, but knowing that we're not going to 100% eliminate any risk that you may have to protected health information maintained by your office or your practice or your business. So we mentioned the first acronym, PHI. What does that mean? Individual identifiable health information that relates to an individual's past, present, or future physical or mental health or condition, the provision of health care to the individual, or the past, present, or future payment for the provision of health care to the individual, and that identifies the individual or for which there's reasonable basis to believe can be used to identify the individual. There's 18 specific identifiers of PHI. Some of them are quite obvious: name, address, social security numbers, but it includes such things as IP addresses, URLs. So again, 18 specific identifiers of protected health information. Anytime you take any of those 18, produce, save, transfer, or receive them in electronic form, it becomes electronic protected health information. The acronym EPHI. We put the little E in front of the PHI. To me, PHI and EPHI are interchangeable and synonymous terms. The regulations sometimes say PHI when technically it's both PHI and EPHI. Sometimes I refer to the PHI when technically it's also EPHI. So again, anytime you take any of those 18, produce, save, transfer, or receive them in electronic form, it becomes EPHI. So we mentioned a couple of these categories early on. Who must follow the HIPAA security rule? Regulations identify two categories of individuals, organizations, businesses that must comply. Those are covered entities and business associates. We're going to define both. Covered entity is any provider of medical, dental, or other healthcare services or supplies that transmits any health information in electronic form. This includes health plans and clearinghouses that perform billing functions. There are what we call transaction standards for which HHS has published standards for. So basically, if really the rule here, if you're billing for any type of healthcare services, um, then you're going to be considered a covered entity. I would say just about every type of healthcare provider in the country right now would be considered a covered entity. There's probably a few exceptions that I've seen kind of on the mental health and the therapy side, which individuals are just performing the services. And it's an out-of-pocket expense for those individuals taking advantage. But I'd say, again, just about every type of healthcare organization in this country now would be considered a covered entity. And then there are business associates. So with certain exceptions, it's a person, right? It could be an individual, another business, an entity. If you create, receive, maintain, or transmit PHI or EPHI for a function or activity regulated by the privacy rule for a covered entity, you're going to be considered a business associate. So that includes IT companies, cloud storage, legal, data analytics, management services, accreditation. But the key here is you're going to have access, or you're going to allow access to that business associate. Um, you're going to allow access of your protected health information so that business can then provide a service to the provider or to the practice. And then when you have these arrangements with business associates, you must have what's called a BAA in place, and that is a business associate agreement, another one of our HIPAA acronyms. And it's agreement between the covered entity and the business associate, and it stipulates the requirements that must be in place for, again, this exchange of protected health information. You must have a BAA in place with all covered entities, and a BAA can also be in place between a business associate and a subcontractor business associate. What I look at here is what we call the downhill flow of the EPHI, right? So that means if you engage an IT company or what we would call a managed service provider, and let's say that that managed service provider outsources cloud storage on behalf of the practice, but the managed service provider is paying the monthly fee for the cloud storage. In that case, the subcontractor would be the cloud service provider, the business associate would be the managed service provider, and then the covered entity. So just to be clear, a BAA is not a contract for services. Though I have seen with larger organizations such as EMR, EHR companies, sometimes the BAA is embedded in the contract for services. But in a perfect world, we like to see this BAA separated out as a standalone agreement. Be happy to answer any questions about the need for business associate agreements when we get to the Q&A portion. So there are two primary rules that govern HIPAA compliance. The first one we're going to talk about is the security rule. And as you can see here, it set the standards for the protection of EPHI. It requires the appropriate administrative, physical, and technical safeguards to ensure the confidentiality, integrity, and security of EPHI. You'll see that theme again in terms of administrative, physical, and technical safeguards when we get to policies and procedures. And just be aware that HHS is proposing some significant changes to the HIPAA security rule that's going to focus on cybersecurity safeguards. I feel that these are way overdue. I've reviewed them all. To me, they just seem like best practices that already should be in place. But just be aware that these proposed modifications are probably coming sooner than later. Then the second primary rule is the HIPAA privacy rule. And this created national standards to protect individuals' medical records and other healthcare information, especially considering healthcare transactions are being conducted electronically. So again, we go back to the mid-90s when the legislation was created. And what happened then, right? We're going from the world of paper charts to electronic health records and data being backed up. Again, early on cloud, but electronic data was even being backed up on premises, right? So the legislation, again, addressed the concerns for this healthcare data now to start being transferred electronically. And what the privacy rule does too, it created safeguards that providers and plans must use to protect PHI. It also sets the limits on the use and release of health records. We'll talk about that in just a second. Then parts of the privacy rule do also apply to business associates. So where I see a lot of confusion under the privacy rule is when we talk about permitted disclosures of protected health information. And a permitted disclosure is when a healthcare provider is permitted to use and disclose PHI without an individual's authorization, but only for the following purposes or situations. To the individual, really the big one is TPO. We're going to define that in a second in terms of treatment, payment, and healthcare operations. And you can see the rest of the permitted disclosures. Public health activities, emergencies, again, we go back to our COVID days, right? So healthcare providers had reporting requirements to state and local health departments. State and local health departments had reporting requirements back to CDC. So in that scenario, what that meant is every time an individual was diagnosed with COVID and the reporting had to take place, you didn't have to get any type of approval from the patient to pass that information on. So again, I see a lot of confusion here. What I run into on occasion is organizations saying, well, we can't tell you because it's a HIPAA violation, not knowing what is contained or allowed under permitted disclosures. So let's talk about the TPO. Let's start with treatment, and it's pretty broadly defined. Generally means the provision, coordination, or management of healthcare and related services among healthcare providers or by a healthcare provider with a third party, consultation between healthcare providers regarding a patient, or the referral of a patient from one healthcare provider to another. So again, pretty broadly defined. Then there's payment, encompasses the various activities of healthcare providers to obtain payment or be reimbursed for their services, for health plans to obtain premiums, and really for organizations to be reimbursed for their healthcare services. So again, somewhat broadly defined. And then really the catch-all is this one, healthcare operations. And this is the abbreviated definition. Certain administrative, financial, legal, and quality improvement activities of a covered entity that are necessary to run its business and support the core functions of treatment and payment. So again, care coordination would come under this heading. There's a lot to this one. So anytime if these don't apply, then this would be what we'd call an authorized disclosure. Now, I don't have a slide on authorized disclosures because in the interest of our limited window today to run the webinar, I'd be happy to talk about authorized disclosures. Again, you have permitted, which are allowable. We covered those. Anything that's not permitted would be considered an authorized disclosure, and I'll be happy to answer questions about authorized disclosures during the Q&A portion. So moving on, probably the reason why a number of you are on today's webinar, it's really the role of the HIPAA compliance officer, right? So if you're working for a small medical practice, when you're designated as a compliance officer, you're going to really be wearing multiple hats within the organization. Oftentimes, I've seen in small healthcare provider settings that the practice manager, the office manager, is designated as the compliance officer. We're going to talk about the two specific roles when you're named as the compliance officer. In addition, that office manager may be the receptionist on some days. That person may also be the point person to handle IT. So again, you're wearing multiple hats, but we're going to look at the two roles that you would be responsible for as first, the HIPAA privacy official. And again, broadly defined, oversees all ongoing activities related to the development, implementation, maintenance of, adherence to the organization's policies and procedures, covering the privacy and authorized access to patient, this says client, but it'd be patient health information in compliance with federal and state laws. We do have a number of clients that are located overseas, so we always like to make sure they understand these are US federal laws. So again, really everything to do on the privacy side is the role of the privacy officer. And then we also have the security official, and they're responsible for the organization's security program and compliance, including IT network security, oversight of the annual and ongoing risk assessment process, development, implementation, maintenance of policies and procedures, and ensuring the confidentiality, integrity, and access of the PHI. Monitor program compliance as well as conduct any type of investigations and track security incidents. And again, similar to privacy compliance with federal and state laws. Again, a compliance officer would wear both of these hats. We're going to talk about program management towards the end of the presentation. So there's a lot going on here in small to mid-sized practices. Often, as I mentioned earlier, I see the role of the compliance officer. It's a collateral duty sometimes, but again, the regulations say you have to designate both a privacy and security official. Again, if you want to combine the roles, that's fine. As long as in the job description for the compliance officer, it mentions that they'll serve as both the security and privacy official. So there's three critical pillars of HIPAA compliance. We're going to talk about each of these. The risk management plan will define what that means. The security risk assessment, oftentimes you'll hear the acronym SRA, and then HIPAA security awareness and privacy training. So let's talk about the HIPAA risk management plan. This is really the foundation for compliance for the organization. So the following areas must be covered with policies and procedures. Remember we talked early on the definition of the security rule? Well, here it comes again with our administrative safeguards, technical safeguards, and physical safeguards. Your risk management plan can contain general office policies and procedures. The ones that we develop for our clients also include OCR guidance documents, the required reports and forms. You must have a contingency and disaster recovery plan. That is a HIPAA requirement, in addition to having a facility security plan. So again, regardless of the size of the organization, regrettably, the regulations are a one size fits all. Now, you can determine what's reasonable and appropriate for a smaller practice, but you still have to comply with all these requirements. So oftentimes when I work with small to mid-sized providers, they are lacking disaster recovery plans. We develop those for our clients, along with a facility security plan, which covers some of those physical safeguards, right? Access control. So if you're a small practice, let's say you're a small dental practice, right? And you still have what we call mortise lock. So you put the key in the lock, right? So those are mortise locks. Well, how do you issue keys? If a key is lost or stolen, what's the process? Is the office alarm? So these are all things that we look at for facility security. Do you have on-prem servers, or is all your EPHI data cloud-based? These are all things we look at when we do our services. We conduct what we call a facility security survey to help kind of figure out what's going on in a particular practice or office. And not to get overly technical, but you can, what we call the citation. The plan needs to address these CFR requirements. So the policies and procedures must address what's called the HIPAA security standards and implementation specifications. There's about 50 of those. And then you must also include what's extremely important is your breach notification policies and procedures. So if you have a breach, how does this unfold, right? So we want to try and avoid when a breach occurs, any finger pointing, saying, well, it's their responsibility or it's his responsibility. Again, you want to have solid procedures in place. I think the breach notification policies and procedures we develop for our clients are significant. They're about 2-3 pages, right? Because there's a lot going on here. I do run some webinars that just talk about the breach notification process. So there's a lot to it in terms of what notifications need to take place. Again, I'll be happy to answer any specific questions about breach notifications during Q&A. So we're going to move on to the second critical pillar for HIPAA compliance requirements, and this is the HIPAA risk assessment, or sometimes referred to as the SRA, the security risk assessment. And what it is, it's an assessment. Sometimes you'll hear it referred to as analysis. It's a comprehensive evaluation of the organization's enterprise, again, regardless of size, to identify the EPHI and the risks and vulnerabilities to the EPHI. So what we do is we want to determine every endpoint where EPHI can hide in an organization. Some might be quite obvious: on-prem file server, cloud-based file server, your EMR. But where else can it hide? Can it hide on a multifunction machine that you use to copy fax and scan. Not if anyone is still faxing these days, but those have hard drives or memory chips. Do you have external hard drives that were used at one point to back up data that are sitting in a closet somewhere? So again, it's these small endpoints that tend to get organizations into trouble, not the big items such as your EMR or your on-prem file server, but I have seen issues with on-prem file servers too in terms of access control measures. So again, this is the process. It's to determine these potential vulnerabilities, and we use the assessment to make modifications to kind of reduce these risks to a reasonable and appropriate level. And this is a compliance requirement. So if you were to have a breach and OCR conducted an investigation, I guarantee you one of the first documents they will ask you for is a copy of your security risk assessment. And the term that OCR uses is it must be accurate and thorough. Again, we see this theme here with the security rule in terms of the confidentiality, integrity, and availability of ePHI held by the organization. And the outcome of the risk assessment helps us determine whether what we call the implementation specifications or the standards are implemented, are working, and are reasonable and appropriate. So again, just a few things about risk assessments. And I should also say that risk assessments must be fully documented. A checklist is not sufficient. So the risk assessment process needs to be very comprehensive. And the ones that we do, I think we're up to about 55 pages. There's about 118 or questions with follow-up questions. But again, it's not the quantity, it's the quality and the content of those risk assessments. But again, the point here is if you're using a 2-page checklist, that's not going to be sufficient. So let's move on to the third critical pillar for HIPAA compliance requirements, and it's HIPAA security awareness and privacy training. Now, it is an annual requirement for all workforce members, including providers. It must be documented that the workforce received the training. So providers, we may have some providers on today's webinar. Sometimes in small practices, I know that providers may have hospital privileges, and sometimes when they do, they have to take that hospital's training, their HIPAA training. Sometimes I'll hear that the provider's taken training at the hospital, they haven't taken the practices training. I don't know what's in the hospital's training. So again, I would always strongly encourage all providers to take your practices HIPAA security awareness and privacy training. And there's required content. So we must talk about the use of periodic security monitors. The organization should be, again, regardless of size, you must be utilizing periodic security monitors. Training must cover password management and safeguards. Login monitoring, what does that mean? Well, we're going to tell the workforce we're conducting login monitoring. Why are we going to do that? Because there is an audit requirement under the HIPAA regulations. So we're conducting audits to determine if the access by the workforce is appropriate and determine potential anomalies. So again, we're telling the workforce during our training, we're conducting login monitoring. And you must include content about malicious software, how to detect, guard, and report. So that's critically important. So if you outsource IT, we're going to talk about that in a few minutes here. You may get some input from your IT company. But again, the training has to cover that. Now, I've seen a bunch of methodology used for training in larger healthcare organizations such as hospital systems. I've seen the attestation methodology where, maybe monthly, it may be every 2 weeks, where the training department within the hospital will push out policies and procedures in which the workforce has to review those, attest to understanding those. That's how some organizations run the training. I think short and to the point works for me. Again, kind of what we're doing here today, just kind of overview of some of these rules and regulations, a little bit more, again, if you're covered entity, a little bit more about permitted and authorized disclosures. Because again, you don't want any of the workforce saying, well, no one ever told me I couldn't do it. Because we know that the workforce are not going to read an employee manual or policies and procedures. So I think it's critically important, as you would with the policies and procedures, include organization specifics within your HIPAA training program. Now, I've seen organizations that will, if they're still doing it, they'll buy a DVD and put it on, the screen, and during break, everybody's watching the training. As long as it's documented, there is a CFR requirement that mandates that you do document that the workforce has received the training. Again, I'll be happy to answer specific training questions when we get to the Q&A. So as I mentioned a few minutes ago, um, your HIPAA compliance program takes program management. I can't tell you how many hours are needed. It's really based on the organization, what level your compliance program is at, but who's responsible for this? Well, we talked about the privacy and security officials. There's a component now for information technology and cybersecurity support. We're going to talk about that in just a second. And then device management. That's extremely critical. We're going to talk more about that in our next slide. But my point here is it's not about just creating the policy and procedures and putting them in a binder and putting them on the shelf, and they're there if we ever need them. That, regrettably now, when we're going to talk about cybersecurity in just a few minutes, there's a lot going on, and I'll get to that. I'll get to healthcare data when we get to the cybersecurity slide. But the point here is it takes program management, whether it's that person wearing the multiple hats, whether your organization's large enough where you have both a privacy and security official. It's going to take program management. We're just touching the surface today with some of these requirements. But like I said, regardless of the size of your organization, I work with a lot of small organizations, and they're surprised when I tell them that you have to designate a HIPAA privacy and security official. And again, like I said, can be a collateral duty. And as I said multiple times now, someone wearing a lot of hats. So let's talk about information technology, because in my experience, I do run across some weaknesses when it comes to information technology for small to mid-sized providers. Some try to do it in-house. Some will outsource it to what we call a managed service provider. Um, I'm moving towards the philosophy, regardless of the size of your organization, that organizations, this is a specialty, and this should be outsourced to a managed service provider, a professional that does this on a daily basis. And I always recommend that if you are outsourcing, just make sure your managed service provider understands the HIPAA environment. I've run across a number of IT companies that are providing services in the healthcare sector. They don't understand primarily the HIPAA security rule requirements. So again, just my advice, if you are engaging a managed service provider, just ask them their experience with HIPAA compliance requirements. So some of those areas under information technology, again, if you're the person wearing the multiple hats and you're handling IT in-house, you're going to be responsible for network testing and monitoring, overseeing network security and risk mitigation. That's to the network. That's not the HIPAA risk assessments that we're doing. Connectivity and bandwidth, providing data storage, whether it's on-prem, whether you're outsourcing to a cloud environment. And really a big one now is asset inventory and device management. Asset inventory is a requirement in those CFRs under the security rule. And what's significant too is device management, really having an accurate inventory and knowing every device that can create, receive, maintain, or transmit electronic protected health information or store it. So obviously during COVID, we had a lot of pivot to telehealth, a lot of pivot to remote work. Company-owned or practice-owned devices were leaving the premises. That's fine. We also have to look at BYOD, right? Does your organization allow your personal device to access a network that contains protected health information, right? Can a personal device access your EMR or your email system or an on-prem server? There's a lot of pitfalls here with using personal devices. So if you have any questions about whether or not your organization can use personal devices, please ask me during Q&A. Again, managing installations and upgrades, implementing software patches, that's critically important. It should be automated, but again, you need a verification that those software patches have been implemented. And cybersecurity safeguards. This is a bullet that I've recently added because, again, you heard me talk earlier about modifications to the HIPAA security rule that's going to focus on cybersecurity safeguards. And this is critically important. I think the next few slides, you'll see why. So during all of my training, all of my presentations, I've really expanded this section probably over the last 5 years on cybersecurity and HIPAA requirements. We're only getting the kind of abbreviated version here today. Again, basically due to the length of today's webinar. But health information is a prime target for bad threat actors. There's been a significant increase in cybersecurity threats, breaches, malware attacks, and ransomware attacks. This occurs every single day. No organization, large or small, is immune. Again, in my experience, small to mid-sized providers, I see more vulnerabilities with them because, again, there's some reluctance to outsource the IT support. But health information has become this prime target for bad threat actors. The primary target. Why is that? Because as we know, over the years, the financial and banking sectors, they've hardened their systems, right? So if you're on your phone and trying to get into your bank app and you have to wait for the code or what we call multi-factor authentication, you got to flip between the screens, right? It's intentional, right? It's to prevent an unauthorized access to your bank and ensure that you're the one that's actually logging in. Well, healthcare is getting better. We're catching up, but we're not where we need to be. So, as I said, I think this is critically important now to address cybersecurity within a practice, again, regardless of size. I make my point here, 81% of all HIPAA breaches were hacking and IT incidents. OCR hasn't updated the stats, so these are somewhat dated. Again, the last time they pushed this out was September 30th, 2024. I anticipate this number to continue to increase. It has every year since OCR pushed these stats out. And it's troubling. It really is troubling. And this is why I emphasize now the need for cybersecurity safeguards and most likely the need to outsource this to managed service providers that specialize in cybersecurity safeguards. So ransomware, I think we're all familiar now with ransomware attacks. It's when bad actors get access to the network, encrypt your data, and subsequently, if you have not sufficiently backed up your data, you're going to have to pay a ransom to get that back. Usually Bitcoin now is the preferred method of payment because of the inability to track. When there are ransomware attacks and organizations are paying, what that tells me is that they have not significantly backed up their data and they have no choice but to pay to get the data back. Just know that ransomware attacks are considered HIPAA breaches. I have a Google alert set to HIPAA breaches notifications. I'm probably getting 3 or 4 emails a day with notifications of reported breaches. There's a whole process for breach reporting. We don't have time to go into it today, but just be aware there is a self-reporting requirement to OCR, regardless of how many individuals were involved in the breach. There's 2 categories. 500 or more, fewer than 500, and there are requirements under both of those categories. I'll be happy to answer any specific questions about breach reporting when we get to Q&A. So what are the penalties? The penalties are based on a level of negligence for noncompliance, and the civil monetary penalties range from 100 to 50,000. Now, these are not inflation adjusted. I believe now, if I pulled up my chart here, that $100 is now inflation adjusted to 171. I don't know what the 50,000 is, but maximum penalty of 1.5 million per identical provision, which in government speak means if it's not identical, it can exceed that. I believe the largest settlement to date is a $16 million settlement for Anthem, Blue Cross Blue Shield. That breach affected 79 million individuals. And also criminal penalties. That's up to 10 years in federal prison. I've seen a case out of Tennessee. It was individuals working in a hospital. They were stealing patient information, selling it to document vendors. Everybody involved in that scheme got jail time. So it doesn't happen all that frequently, but it can. So I just want to talk a little bit about some enforcement actions because I think there's been some misperceptions with this new administration. If you follow what this administration has been saying since it's been in office, rolling back regulatory compliance requirements right across the board. Well, that is not the case when it comes to HIPAA enforcement. As a matter of fact, since January 20th, there's now been 9 enforcement actions. So I just want to go through a couple of these and just point out a few things. So the latest one was announced May 30th. This is Comstar, $75,000 settlement. This is from a ransomware attack, the subsequent cybersecurity investigation. The next one, Vision Upright MRI, $5,000, kind of minimal. The CAP means a corrective action plan. That means you're going to be OCR's best friend for the next 2 years as they monitor your compliance program. But number 2 and 3, both of these were relatively smaller providers. And in the press releases that OCR pushed out, they made a point of identifying these organizations, Comprehensive Neurology and Vision Upright MRI, as small providers. So I think that's what we call in the trade message sending, right? It means that regardless of the size, we're still going to proceed with potential enforcement actions. I'm not saying every reportable breach ends in enforcement action. It doesn't. I think in some cases, OCR, and I know from experience with our clients that have had breaches, and I'll just say that we've been brought in after the breach occurred, not prior. And in all of our cases in which OCR was involved, luckily all of our clients received only technical guidance. But again, it doesn't mean that OCR can't proceed with imposing civil monetary penalties and getting you to negotiate a potential settlement. So again, here's a few more we're just going to see here. Phishing attack with PIH Health. Guam, yes, it's a territory, so they're still required to comply with HIPAA compliance. Another ransom cybersecurity related event. Northeast Radiology, a security rule violation. Again, all of these are public, so all the resolution agreements and corrective action plans, which I read through all of them, they're all public. Usually what I see, there are 3 primary areas that organizations have not met. And those go back to, if you recall the slide on the 3 pillars, right, that the organization doesn't have comprehensive policies and procedures in place. They didn't conduct an accurate and thorough risk assessment. They didn't train the workforce. And then usually there's a number of other findings really related on the nature of that breach. Again, a few more here. So the last 2 are what we call CMPs. So this is where HHS imposes the civil monetary penalty. And when they do that, the point is to try and get you to the settlement table and negotiate. But in this case, with Oregon Health and Science University, and then Warby Parker, yes, the glasses company, in both these cases, they decided, you know what, we're just going to pay the penalty. We're not that way. We don't have to go on a corrective action plan. Their attorneys just and again, I'm speculating that their attorneys made the determination it's just better for us to pay the penalty and move on. But Warby Parker, that was a $1.5 million penalty. So again, point here is enforcement is robust. If I was to look into my crystal ball based on the background of the new OCR director, I know that she's a privacy hawk. So I would speculate that enforcement will continue to be extremely robust and OCR will continue to settle these cases and ramp up their enforcement actions. Again, you look at a couple of those early cases, as I said, they're message sending. So that's my advice, especially for small to mid-sized providers. If you don't have what's required in place, now's probably the time to start the process. And then there's been almost $148 million in settlements and penalties. Now, that's unofficial. That's me doing my math because those 9 cases that we just looked at, OCR has not updated, or HHS hasn't updated their website. So that's me adding these up. I'm not a math major, so hopefully that dollar amount is correct. So just concluding a little bit about our services and what we do. We're considered a full service consultancy, which means that we're going to be doing most of the heavy lifting. We always offer a free initial consultation. We will develop your risk management plans. As you can see here, what the regulatory requirements call for. We do conduct the risk assessments, which means that we ask the questions. I know that some of my competitors will give you a link to a self-assessment. You got to go on there, try and figure this out. You don't understand the questions. It gets very time consuming. We have either myself or one of our compliance specialists, we conduct the risk assessments. So we can answer the questions real time. We also conduct privacy assessments. We have covered entity and business associate versions. I think it's really important for covered entity to do a privacy assessment, although not required under the privacy rule, as the security risk assessment is required under the security rule, but you still have culpability under the privacy rule, right? There are things like minimum necessary requirements and those permitted and authorized disclosures. So it's helpful to go through that assessment. We do a breach rule assessment as part of our overall security risk assessment. Again, we want to ensure that you have your breach notification requirements in place. Again, you can see the respective CFRs there. We've also, within the last 5 years, we've added a cyber and information security assessment, although not required. It does address significant cybersecurity topics, and it crosses over some of these security and technical safeguards in the security rule. And it's really, we're a little bit ahead here because it also addresses some of these potential modifications that are coming to the security rule. We generate what we call a HIPAA compliance program report. We kind of look at every aspect of the organization's compliance program and just, again, assessing where they're at. We conduct training. We have various platforms. We have web-based training. We have self-enroll. I do a lot of training via, like today, via a Teams call. We also do policy and procedure reviews, just hourly consulting. We have a service where there are small providers. We're offering virtual HIPAA compliance officer services. As I mentioned in my bio, I also serve as a subject matter expert for litigation. And then for our business associates, we're providing an attestation letter once they meet all the requirements. This is going to be under these proposed modifications. What eventually will be required is that written analysis. So we're already doing that for our business associate requirement, business associate clients. So with that, I know I've done a lot of talking over the last 45 minutes or so. So with that, I'd like to open up the presentation for Q&A and for chat. For Q&A, and again, you can either use the chat feature or the Q&A feature. And then when you enter your question, I will not read who is submitting it. I'll just read the question. So with that, please submit your questions. You know, we covered a lot. We kind of scratched the surface on a lot of these topics. Like I said, I have some of these topics where I go more in depth, and those are actually 1 hour webinars. So please, now's your opportunity to ask questions. I see no questions coming in. So with that, my contact information is up here. If you do have a questions or you'd like that initial consultation, please reach out to us. Just mention that you attended today's webinar. Again, anything to do with HIPAA compliance, I'll be happy to answer any questions. So if you don't want to ask on the webinar, just shoot us an email and we'll be happy to respond. So again, with no questions, I just want to thank everybody for attending today's event. Thank you.